If you're struggling with shoulder pain and the exercises that you have been given are making it worse, you're not alone. Let's talk about the 3 biggest mistakes that I see and what we can do instead. Welcome to the Joint Longevity Lab by Fitness Integrated Science. I'm Lauren Irk, and in this video, I'm going to go over the 3 most common rehab exercises that are often prescribed for patients suffering from such things as rotator cuff tear, tendonitis, bursitis, and even frozen shoulder. I'm going to not only go over these exercises, but tell you why they are actually ineffective and show you some things that we can do as an alternative to improve our joint mobility and decrease our joint pain. Now, the first exercise that I want to talk about is called the pendulum. The pendulum exercise is just like a pendulum on a clock. As the pendulum swings back and forth, we want our client to do the same thing. So the way that we would start this exercise as a setup is to bend forward so that way our body is in perpendicular to the ground, and as we move into a position of shoulder flexion, the arm itself is in line with gravity. So if we have a client, let's say our patient, where I can't move my arm very far into flexion, I have maybe this pain that shoots down my shoulder when I get this far. When I bend forward, now gravity is running through the length of my arm, so moving into that flexed position should be much less painful and much more doable. Once I get here, then I want to practice kind of moving my arm forward and back, much like that pendulum on a clock. And if we have an inability to do that, I've even seen patients been told to shift and rock their body weight forward and back to sort of get that arm going. Then from there, maybe just letting that arm move in a circle in one direction, and then moving in the other direction as well, trying to specifically allow that shoulder to stretch apart. So as that shoulder blade starts to move off the back, the position is called protraction. The idea is that we're stretching the shoulder capsule, we're stretching the muscles, we're increasing blood flow, and we're reducing pain. Are we really? Actually, it's the opposite. One thing that I teach all the time on my platform, Fitness Integrated Science TV. If we want our joints to move better, we need to train our muscles to contract better, because muscles move joints. Is this exercise going to strengthen muscles that protract the shoulder, which would be our pecs, our serratus anterior, to name a few? No, it's actually helping them. They're actually able to sleep while we're doing this exercise. So for a muscle to become stronger, we have to set up a resistance scenario. It's got to oppose. I've got to have a resistance going this direction so that this muscle comes against it and has to push, forcing that contraction in the muscle. This is not happening in the pendulum exercise. Here's a quick fix. If I take my arm and place it on the chair, now I've got something, because the chair is pushing up while I'll push down. So if I take my hand on the chair and push down, maybe even down and in, I can practice actively moving my shoulder off of my back, training such muscles as the pec minor, maybe the pec major, the serratus anterior, muscles that actually protract the shoulder, going back and then letting it relax, pushing down and in, squeezing across those protractor muscles, and then bringing it in. That is actually going to do a whole lot more to get that feeling of muscle tightness to release than letting that arm hang. You don't want your arm to just hang. As a matter of fact, shoulder dislocations are very common. The shoulder depends on the muscular system so that the arm maintains contact with the shoulder blade. So we have to work on the opposite motion, and that is retraction. That's going to be simply moving the shoulder blade onto the back by using the weight of the arm and pulling that shoulder blade into the back against the force of gravity. So allowing that arm to drop down into the pendulum, but also squeezing that shoulder blade into the back is going to actually create joint stability. With more stability, we have more mobility. That's a very important principle. Also, we need elevation if we want to move into flexion. So that motion would be moving my shoulder up into the ear against gravity. We also need shoulder depression, which is moving the shoulders down out of the neck towards the floor, which both of those are not being trained in the pendulum exercise. I could be sitting in a chair here, moving my shoulder into my ear for my elevation, and then as I push down, I could also be moving my arm into the chair itself so that I can help muscles like the rhomboids and the levator scapula to depress and lower that shoulder. Now, when those 4 motions are better, we're going to be more apt to move into much more of a flexed position on our own with our muscles actually contracting. As we improve the muscular component of the shoulder, we're going to notice less pain and more mobility, which I know seems counterintuitive. All right, so let's look at my next exercise, which I like to call the shoulder flexion exercise with the stick. It's the forced stick exercise. So let's say that if I'm looking from a standing position, right now my arm is hanging by my side. So if I start to initiate shoulder flexion, I don't have to resist gravity a whole lot down here, but you can see that as I start to move higher and higher, now gravity is sitting right on top of my arm at a 90-degree force angle, which is going to make these muscles have to work harder. So many times you see frozen shoulder patients, injuries, where they have a hard time moving past here. So one of the quick fixes is just to have that client lie down on the ground and get really good at these motions down here, and then over time, hopefully they can get up in there. And so what a lot of times I see clients be told by their therapist is that if I grab something, and this is a weighted bar, but let's say that I'm using a dowel rod, something that has no weight at all. If I've got one shoulder that's only moving this far and the other shoulder can move full range, I'm going to use my good shoulder to help my bad shoulder. So I'm grabbing the dowel rod, and as I start to move into shoulder flexion, as this starts to max out, this arm can actually help the other one along. So if I'm coming down on the ground, it would look something like this. So I'm starting down here, which the resistance is obviously going straight down through me, and as I start to move my shoulders into flexion, I'm moving the dowel rod, I start to notice that maybe this shoulder starts to tighten up. So my stronger shoulder will pull up to the dowel rod and the idea is to stretch the muscles that flex into the shoulder, such as the serratus anterior, things like that, moving that shoulder into this position. And we come into that and then lowering that down. The thing is, by letting this arm sit on the dowel rod, it's not doing anything to strengthen anything. If we only work with this stick, a lot of times what I see clients do is they enter into that protective range, the stick is pushing through it, and they're feeling pain, told that they have to work through the pain if they're ever going to get that shoulder to move better. So let's do a little something different. If I start my shoulder rehab exercises just working against gravity at these positions that are closer to the floor, which are actually going to be less joint changes, less muscular recruitment, and just start working on moving from here down to here. I'm working with the weight of my arm and I'm getting stronger and stronger. And as muscles contract better, I may be able to slowly approach that 90 degrees. And here's the thing, on the ground, once I get to here, my resistance is 0. So I have the most resistance down at the bottom, working against the force of gravity. We're dealing with body mass, and then going to 0. As I got good at that, then I could practice standing up, and now my resistance down here is nothing. But as I start to move higher, now I'm starting to feel an increase of resistance. So it becomes more and more challenging to get to here. And once I can get to here with ease and my muscles can actually deal with the weight of gravity, my own body mass, I may be able to even add something like a light TheraBand. And by doing that over time, I might be able to slowly begin to move my arm over my head. If we do this in a progressive way, not trying to force shoulder flexion and always trying to position the shoulder against gravity to work the desired muscles, guess what happens? I experience a reduction of pain and an increase of mobility if my shoulder allows. Now, for my last exercise, and this is probably one that I see the most, this is what I like to call the door stretch. Now, I don't have a door right here, but hopefully you can imagine. So a lot of times when someone has an injury in the shoulder, this motion is like the first one to go. This ability to externally rotate, and you see patients sort of doing this. And so we sort of combine two motions to bring the arms up into the door. Number one, we have abduction. So the patient is taught that they need to abduct the shoulder. Let's say this is as far as I can go. I can only move my arm out to the side, knowing that gravity is sitting right on top of it. And then I want to try to come into external rotation. So I'm going to put the door in front of my shoulder, and I'm just going to push into it. As the door pushes this way, my muscles are also supposed to pull this way. Everything is assisting me to try to move back into the scarecrow or the goalpost. And the idea of that is we're trying to stretch the front of the capsule. Just like the shoulder flexion exercise, just like the pendulum, the resistance is going with us and not against us. This is not going to make your shoulders stronger. It's actually going to make your muscles weaker and keep your pain going longer. So what do? We flip the script. We need to have the resistance going against us. Instead of pushing into the door, which is pulling in the same direction, we need to have resistance going back this way that we can press against to improve the quality and strength of that muscle contraction. So I would definitely recommend doing this on the ground to start. So if I'm going to come into the ground and I'm starting off in a position of, let me just grab this block. If I'm starting off in a position of abduction, I'm going to go to 90 degrees. Then I'm moving my arm out to the side. Let's just say that that's as far as my shoulder moves today. I'm going to very lightly use the floor itself to push down against. And what that's going to do, it's going to give me some feedback in some of my rear delt, possibly my middle trapezius a little bit, trying to get those shoulder extensor muscles stronger to be able to bring that shoulder and upper arm bone back behind my body. Then the next motion is going to be external rotation. And let's say that I can go to here, but I don't have any more ability. I don't want a door or something else or a dumbbell pushing my arm to the floor. I want to strengthen these muscles so that I can do it on my own. So something like a yoga block works great. It gives me feedback that I can actually press against. So I'm very lightly pushing my elbow into the floor and then moving the back of my hand into the block. Now, just like a progression that we did from the shoulder flexion exercise, we can also do this from standing. So let's say that I'm going into a wall. Well, now when I come into shoulder abduction, I'm working against gravity as I move my arm out to the side. You can see that gravity is sitting right on top of my humerus, and I'm working up and against it. That's a great thing I can do. I can feel the force of gravity and push into the wall at the same time, a great force couple. And shoulders love resistance. The shoulder is largely held together with muscles, ligaments, and tendons. If we don't have muscles in our shoulders fall apart. Then the next position is to try to externally rotate the shoulder. So one way to do that, I could take my shoulder attachment off the wall, kind of come away from it and push into the wall this way. But what I like to do again is just to take that yoga block or some kind of a towel or anything, a pillow, and just fill up the space between the arm and the wall so that when I press back against it, I can start training my external rotators, such as my teres minor and my infraspinatus, to try to heal that rotator cuff. When muscles can contract better and when they're stronger, injuries can heal, mobility improves, and actually pain diminishes. This may be a little different from what you have been told, but I guarantee you, if you practice those 3 exercises differently on a regular basis with consistency, without pushing too hard, in other words, pushing and using too much resistance, and also not forcing my range of motion, always making sure that I'm working within my own anatomical barriers that my body is setting forth, so I've got to pay attention. If I don't force and if I don't use too much resistance, my body will start to experience less inflammation. I'll start to recognize that stability versus instability, and my shoulder will start to heal. Now, if you'd like to be led step by step through positional programs where I'm actually working on strengthening muscular system and improving joint stability, head on over to Fitness Integrated Science TV. I would love to have you try us out. I'll give you a 1-week free with the link below. Also, make sure to sign up for my weekly newsletter with education and support. There's also a link for that in the descriptions. If you are not subscribed to this channel, I would love for you to do that so that you never miss another video. Please share this with anyone that you know that I can help. And if you liked it, give me a thumbs up. Thank you so much for watching, and I'll see you in the next video.